Good morning, everybody. It's Dr. Pearlman, and if you're new to the channel, thank you for joining. If you've been here before, thanks for coming back. If you haven't had a chance yet and you want to subscribe to the channel, always a good idea because I believe that the more notifications you get about the shorter videos that I'm going to be making that pertain to your health and the health of your loved ones, you may just find it to be valuable. And today I'm going to talk about something that's been lingering in the back of my mind, and I really need to put it into a better context for people to understand. And that is, there's a lot of information on the internet about disc herniations, back pain, disc bulges, spinal pain, but nobody's really addressing the 800-pound gorilla in the corner of the room. As you can see, the gorilla is right back there staring over my shoulder, and that is spinal stenosis. And what does spinal stenosis even mean? Because when you hear stenosis, a lot of just sort of generic information means that it's compression or choking of the cervical spine, which is the central canal, the cervical spine, the central canal, or like the actual spinal column choking the spinal cord. A lot of what it could also mean, spinal stenosis, could mean spinal stenosis of the intervertebral foramen, or that's more of like a lateral recess stenosis, where it's kind of pinching a nerve root as it exits from the spinal cord out through the foramen. That's a fancy word for hole in spine, as it goes to innervate nerves, muscles, organs, glands. So that's why a lot of times when you have troubling red flag symptoms that might end up being a non-chiropractic case, that's more of a emergent, or I'm not going to say urgent, an emergent case where you need to go to the hospital, the emergency room, and you have surgery, could be from very severe stenosis. And so am I saying that stenosis is severe and you need to go to the emergency room based on every stenosis diagnosis? Absolutely not. But the reason I talked about being gorilla in the room analogy is that some of the most debilitating back pain is often misdiagnosed as weak glutes, weak core, bulging disc, disc irritation, those spinal facet joints, the meniscoid entrapment. I mean, I could probably run out of fingers and toes telling you what you've been diagnosed with inappropriately by other providers, chiropractors, physical therapists, trainers, orthopedic doctors, neurosurgeons. Because here's the thing, a lot of radiologists who get paid, I guess, as their career as radiologists, will do something called a unaggressive, a non-aggressive, what I call lazy report, where the findings may not want to put themselves at risk or the liability of being the person to say, like, stenosis at C5, C6. That's the cervical spine, would be like central canal stenosis at C5, C6, impinging upon the thecal sac. That's something that you might see on a more aggressive reading of a cervical spine report. In the lumbar spine, you might see something like lateral recess, mild stenosis, moderate stenosis, impinging upon the L5 nerve root. But that, remember, is a lying face up or laying face up MRI of the lumbar spine, and not even taking into account weight bearing and what the buckling ligaments would look like in a weight bearing stance. But a lot of times you'll go to the chiropractor, maybe they'll look at your x-ray, or even if they've taken an MRI, and whether it's supine lying like a lot of the ones I get, or weight bearing, which would be the gold standard, like an open MRI of you standing weight bearing looking at the MRI, what would happen is they might say, oh, well, your L4 is a little forward, there's a lot of pressure on the disc back here. I could go on, but I don't want to carry on about what the other providers might say, as some of my patients have heard me talk about the disc. You've heard me talk about tethering. You've heard me talk about, radiculopathy, which is pain going down, a leg or an arm, or radicular pain that doesn't have a sensory or motor loss per se, but maybe you just feel the symptoms of radicular symptoms. So the thing is, on like the spectrum of symptoms and the spectrum of spinal stenosis, it just never is something that is talked enough about in videos to say that that could be the reason that I'm in this like debilitating pain. And that's sort of the underlining message. If your back is consistently going out, if your back is making it to that you have so much trouble getting out of bed, that your back is locked up and you are grit bearing, lying down, your back is crooked, your shoulders are on one side of the room, your butt's on the other. Like, if you followed any of my journey, my older videos, like, I've been there before. And just because I had success via surgery with a partial laminotomy, foraminotomy of L4, L5, L5S1, to give my spine what they call decompressive surgery to give my spine room to breathe, that doesn't necessarily mean that it's something you have to rush into. But certainly you have to go to it or find a chiropractor that knows how to care for stenosis. Okay, that's something that I have adapted to doing well over time. I wasn't very good at it when I came out of school. And then you also have to be able to track it, monitor it, and see where your baseline is to then decide, okay, am I able to live with this amount of stenosis? The same way research shows that the bigger the disc herniation, the more likely it is almost certainly to resore, break apart, and not be there, a year from the time you might first see that disc herniation, even if it's pressing on a nerve. It is, and again, this is research that exists. You don't have to even question me about it. Just go watch 7,000 other videos on YouTube that covered a disc herniation, but a lot of them don't talk about stenosis. Because the sad part is about stenosis is you're going to have to trick your body or train your body's ability to adapt around the pre-existing structures, almost in a more miraculous way via Dr. Strange situation. Wait a minute, you have a such and such spinal condition. How are you playing basketball? How are you riding your bike? How are you running? How are you doing all these things? I thought you were lying down on the couch for 3 weeks. It really is about training the neurology in such a way that includes chiropractic in my experience, but that doesn't mean it's the only thing. I just haven't found anything else to be as effective outside of inevitably ending up on the table for surgical intervention. But even then, you have to have a competent surgeon who's diagnosed it properly and knows what they're doing and has done it a lot of times with great outcomes. And the last thing I'm going to say before I have to go is, if you're going to a chiropractor or a therapist or doctor or provider of any kind with that kind of debilitating back pain, and you are not getting proper imaging, which means at the minimum a set of x-rays, and at the maximum, which is in my opinion gold standard if you're in that much pain and that much debilitating pain in your back, you have got to get an MRI, and you have to get it as soon as possible. And someone has to be able to share with you that the read of the MRI or the report along with going over it in front of you. And if they haven't done that, then you need to get a second opinion, which good for you all out there. You can consult me, and if we can Zoom and I can see the imaging and read the report, even without the report, we can go over whether or not that stenosis is great enough to begin, and of course, matching symptoms to begin to decipher whether or not surgery is for you. So I wanted to make that video because in my opinion, in closing, you better find the right chiropractor who knows how to care for those conditions, stenosis, okay? Cervical or lumbar stenosis or spinal stenosis, whether it's central or lateral, and then you need to be able to really monitor it well over a few months without wasting too much time, because time is all we've got, and quality of life and our health is all we've got, and you need and you deserve to have the right answers so you know what to do next. So thank you for watching this video, guys. Everybody have a great day, and until next time, this is Dr. Pearlman.